You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, it's another one of my Behind the Vet Rehab Practice podcast, and Anae Lloyd from Online Pet Health interviews Maira Rezende from Brazil. Before we head over to their chat, a quick word from our sponsors. PulseVet are the global leaders in vet shockwave technology. They manufacture the ProPulse and Versatron family of products. Now, for those of you that don't know what shockwave therapy is, it's a non-invasive, high-energy sound wave therapy. It can be used on both large and small animals, and it's used mainly to treat soft tissue injuries as well as musculoskeletal conditions. Now, with over 20 years of clinical research, PulseVet is used by top vets and vet rehabbers to improve the quality and speed of healing, helps to relieve pain, stimulate bone and tissue growth, and generally to improve the mobility of their patients. For more information, you can go to pulsevet.com. Now, Anae and Maria had a really awesome chat. They discussed her practice and how she runs it, how she recently now just hired someone to help her with that administration and how that's completely changed her life. She also has a really good long-term outlook, and she has a look at her practice and sees how does that fit into her life plans. I think you're really going to enjoy this one. Over to Anae and Maria.
Hi, Maira. Thank you so much for joining us. Would you please tell our listeners a little bit about yourself?
Hi, it's a pleasure to be here. Thanks a lot for the invitation. I am Maira Formenton. I am a Brazilian that works with physical therapy, mainly in small animals. Okay. Nowadays, I am kind of a researcher. I work in the University of São Paulo with research of physical therapy. My main research fields are pain control through physiotherapy and also biomechanics, animal like dogs and cats, biomechanics. I love biomechanics. And also I am an owner of a rehabilitation center here in São Paulo, Brazil. And we are also expanding the business. Nowadays, after pandemic and everything, we are expanding this business a little bit. And all of it's a little bit complex to manage, but hopefully we can do it.
That's
but maybe
amazing.
these are also I am a teacher and I coordinate the post-graduation course in physical therapy for animals here in Brazil. To work with physical therapy, you after veterinary graduation, yes, you have to go through veterinary school, and after it you have a 2 years course. It's a post-graduation course with 500 hours to graduate in animal physical therapy, and then you will be able to work with it. And now I coordinate this post-graduation course here in Brazil.
So you wear many different hats.
Yes. I work in different places. I'm a little bit hyperactive person.
I think many of us can relate to that. Maira, that's so amazing that you're doing research. I think we've been chatting a lot lately about how to kind of make research clinically applicable and how we can all start to participate if we wanted to in doing some research or collecting data or being part of a project. So it's very exciting to me that that's what you do. And my kind of area that I always get excited about is always biomechanics. So I'm not a researcher, but I love those papers. When I'm looking for papers, 90% of the time it's a biomechanics one that I will choose. So
it's how to evaluate the physical therapy nowadays. Yes, you need to understand and analyze through biomechanics to prove that the dog's really going to be better.
Absolutely. And talking about your course, I'm very interested as well in, you said that you're graduating as a veterinary physiotherapist, right? Yes.
Yes.
Have you guys, are you guys regulating the profession? Is it registered in Sao Paulo? How is your political situation
Yes,
in Brazil?
here in Brazil, we have a law that only veterinarians can practice physical therapy in dogs and animals, any animals, wild animals, horses, cows, any animals, only veterinarians can practice. We still not have the regulation and the requirement for the official post graduation course. Yes, technically you only need to be a veterinarian, but mainly we recommend people to do the post graduation course. There are people, yes, that do just like weekend courses and start practicing. Yes, we know, but this is poor rehabilitation. You know, this is like not good professional. The good ones will take this 2 year, and it's Brazilian regulated by the education minister. Okay, there's a regulation for these courses. You have a lot of rules to follow, and the person needs to go through a lot of proofs and to complete this 2 year course after the veterinarian graduation to finish and be able to practice physical therapy in animals. So we recommend this 2 year course after the veterinary school to practice with physical therapy in animals. And there are a lot of these courses here, with just not one. I coordinate one of them from Bioethicals Institute. It was one of the first, but there are a lot of them nowadays in Brazil, because Brazil has grown a lot the past 15 years in this part. So there are a lot of options to people to graduate and get the knowledge to work properly with physical therapy in dogs and cats. I used to say, do you know that Brazil has one of the best and one of the worst physical therapists? Because we have like amazing people working worldwide, and I can tell you a lot of names that you probably know that are working in a worldwide level. Okay, but also we have these ones that do a like weekend physical therapy course and start practicing in the dogs, and we know that. So we have a lot of good ones and a lot of the worst ones.
I think that's the situation globally, is that there just isn't regulation, which means there isn't a pathway to follow. So there's no standard, which is a challenge. That's why I was asking about the situation in your country. So because it's always interesting, and it's good for us to also realize that we all face the same struggle. You know, we're all facing that. Yeah, that particular struggle.
And I think the good point here in Brazil is that we have this regulation, this law that says that only veterinarians can do it. Because I know that in a lot of countries we have like people with non-formation practicing physical therapy in dogs. Like if there's okay if there's a regulation for physical therapists to do, or for the physiotherapy graduation to do physical therapy in animals after a post-graduation, of course, after training in animals. But there are countries that are non-regulation, and like anyone just buy a laser and starts doing in the dogs. And this is a problem. I think here at least we have some regulation that only veterinarians can practice.
Yes, that helps. So tell us a little bit about your small animal practice. How does that look? How does it work? How did you set it up? How many people do you have working for you?
Well, here was I have my rehabilitation center. It's called the Physio Animal. It was one of the first here in Brazil. So we are we have a lot of veterinarians work here. We have 4 to 5 veterinarians work with physical therapy. We have 4 veterinarians working with acupuncture nowadays. Okay, not the same. We have different teams working, and also we have nutritionists, yeah, chiropractics, and another things that are done like not all days like we call and the person comes just to see that dogs. Okay, we call specialties like
Yeah.
nutrition, chiropractic, microphysiotherapies. You know microphysiotherapy? It's a
I'm not sure.
yes, it's a different treatment. It came from France. It's English.
Okay.
It's amazing. Like massages and then other things. We have a specific person that comes. So we have a lot of places here in my clinic that we can treat. I can show you a little bit if you have the time. I can show
That
you.
would actually be lovely. I would love that. So it's
Yeah.
quite a big practice that you have with quite a lot of people.
Yes, we change terms. Yes, but we try to integrate a lot the dog and work in the dog as a whole. You know, when the dog get in, you will be evaluated for one veterinarian, and this veterinarian will lead the treatment, but this dog will be treated by a team. You know, if I need chiropractics, though I'll call chiropractics will treat this dog and no, okay, now the dog needs acupuncture, so let's put him the acupuncture team, now physical therapy, hydrotherapy. So it's an integrated treatment. And this is how I think it's the best for the dog, you know, because it's true that you won't have, you will never have one single treatment that is good for all the dogs. Yes, you will have a dog that will respond a lot with acupuncture, and there another dog with the same disease that no, it just do not work. And then this dog, we need to change to put him in another treatment, and maybe physical therapy, laser therapy, or even chiropractic is the best for this another dog. And this is the integrated therapies. And also, as veterinarians, we can work a lot with multimodal approach. It's called like we integrate the not the clinical but the medicine treatment
Yes.
like painkillers, uh, like anti-inflammatory drugs integrated with physical therapy, because
Yes.
I believe that integration, like this is not a part like, oh, I will have this medicine so I won't have physical therapy, or the opposite, I'll have physical therapy so I won't have the medicine. I really believe in this integration of all medicines, and this is how we work here.
I love that. It really highlights the team approach and having many brains together, many minds together on one case, so that yeah, that's the way that we get the best outcome. And we often talk about that on online at Online Pet Health, having a team approach, working together with different professionals. So you guys are all veterinarians. That's amazing. Most of us don't have that privilege, so we have to work with referring veterinarians, with specialists, with nutritionists or trainers, and we have to kind of create that team for ourselves, where, you know, depending on the patient that we see and where we are situated and what we need. And that's the best way. That's absolutely the best way, integrating all the professionals and all the modalities in the best way for the individual patient. I love it.
Yes, it's very good, but and we like here we do not have. It's a choose. I choose it not have orthopedic surgery or a neurologist here, was because we are referred by other teams. So if I have one here, other ones won't refer to me. So I choose it not having orthopedic surgeon and not a neurologist or clinics here. So also we try to work a lot with partners. That we do not have the neurologist here, but we call a lot for the neurologist. We try a lot to work as a team, just not our team, but with these partners. Of course, he's not. I know it's not always that we can really talk to people. I know how difficult it is. I have some another colleagues of mine that sometimes we call and people do not even want to talk with us. Like mainly they are very kind and I love the suggestions that we made, but some of them, yes. Oh, yeah, I'm treating the dog. Just do physical therapy. And they say, okay, no problem. We'll do just physical therapy. Yes, there is some time that we need to work, but I always think, as you said, more head thinking on the dog. So it will probably be better. No one can see all. No one knows everything. So this is really a thing. I think, well, maybe just even like people that are starting, maybe they look and look at this and say, oh yes, I haven't seen it yet, and it's different views from the same patient. I really think it's very important.
I agree with you. So you struggle just as much as any of us with getting referrals and building those referral relationships. How do you break through to other colleagues who struggle to see the value of physical therapy? Do you have something that works well for you, or that you can recommend other people to try that might work?
Yeah, I think it's like when you start to show people what you're doing, and when people start to come to clinic, to my rehabilitation center, and they see that, like, imagine it's a clinician, okay, and he refers to me, the first patient. I usually see the patient, do the evaluation, and I give back to him a report with everything I saw in the dog and how I'm going to plan in the treatment. This helps a lot to break this barrier. Also, every time that I see something in the skin and the owner asks me, oh, can you see it? I look, oh, it's bad. Oh, the owner asks me, can you vaccinate my dog? And I say, oh, what I do, I look in my computer which clinician referred to me, and I referred back to this clinician, and I do a little recommendation letter. Please, I recommend the dog to vaccination. So the clinician looks and say, okay, this girl won't rob my patients. This girl will work with me. This girl will treat only physical therapy, medical approach, and like a pain approach, but won't treat other things on the dog. So they stay confident to work with me. It's like something that you need to grow a little bit, but it's a daily work, you know. Usually here, as we have like the clinic has 13 years, so here around me people already know a little bit our work, but when we have new people referring to us, we usually sometimes even call people like, hi, I'm Maira, I received this patient, I'm treating like this, I would like to suggest this and these exams. Like, and to be very strict to the owner, I do not treat skin, I do not I do not do clinic, I do not work with other things. I really will treat physical therapy and rehabilitation and pain, because pain control is one of my specialties. So, but I will be strict to this. And if you need vaccination, if the dogs have another skin lesions, go to the clinic. And this is a daily work for beauty. And,
I think
and
that's a
people
good,
get the confidence with you.
yeah, that's a very good way to do it. Very good. And do you do diagnostics at your clinic, or do you refer back to the veterinarian for diagnostic work?
When we have orthopedic disease, neurologic or pain, yes, because as I work a lot with pain control, sometimes they refer to me even to do diagnosis. Okay, like they're clinicians and they say, okay, I do. The dog is limping, the dog is claudicating. I do not even know. I will refer to Maira. Maira will help us. Will call for. We refer to and then examine and I say, okay, I will need a neurologist's opinion on that. So I call the clinician. Okay, I think it's not orthopedic. I think it's not pain. I need a neurologist. Can I refer to a neurologist? And then I ask for neurologist's opinion and bring back to me. And you need to build a net to work and integrating. Mainly with pain control, like people sometimes like cats that are limping too much their limbs, or dogs that have self-mutilation, and then they used to refer to me to diagnosis this neuropathic or chronic or so terrible pain and treat it. And then sometimes I am referred for diagnosis too.
Okay. I think that is good, because I also think that just like pain control and physical therapy go very well together, we can often add as physical therapists so much to the diagnostic procedure in terms of localizing the areas that need to be imaged or focused on. And I think there's a lot of value in fostering that relationship during the diagnostic process, as well as during the actual rehabilitation. So I think that's great that you're also doing that quite often. So Maira, in setting up your clinic and the way that you work, you're wearing lots of hats and you have lots of people that are working together with you. What are the biggest challenges that you and your clinic face and need to overcome?
Well, here in Brazil, I think, and this I think is worldwide, the competition is very high. Yes, and we have to deal a lot with this, weekend physical therapists that will charge much less, and sometimes people do not see the value. But I think it's one step. Okay, with time people see the difference between them, and that's okay, we can go on. But here in Brazil we have also a big difference, because the taxes for business are very high, and we do not have many government support. So including during pandemic and COVID pandemic, everything was very difficult because of this, like no government help and everything else. But I think to be a businesswoman and to keep my clinical practice, like not becoming only administration, it's a big thing for people who want to open a business and open a rehabilitation center. I know many veterinarians that at some point of their business, they need to let go the clinical practice to another ones and to become only business administration. Yes. And I always thought that I am veterinarian and I like what I do. I do not want to do only business. My choice was to have administrator. Yes. Someone to help me with administration. Yes, I hired someone to do administration. And so I can keep my clinical practice. I think this decision was one of the most difficult ones that I needed to do, because to let go the administration of your business to another one is difficult for us. Yes, because we built, we grow up that, but it was a difficult decision. But at some point, I needed to decide, are I'm going to keep my clinical practice, to keep my work in the university, to keep my work as a teacher, or I'm going to start doing only administration. And I always thought I haven't done like graduation, master, doctor, everything else to be in the office,
Yeah.
So this was one of the difficult things difficult changes and difficult calls that I need to do that I did last years. But it helped a lot me to deal with the business things, because we are veterinarians. We do not know how to do business.
Yeah, definitely.
So it helped me a lot to increase the
The income.
income, to help it dealing with the taxes and with a lot of administration things that I struggle. So
Yeah.
for me, it was really a good decision.
Fantastic. That's fantastic. We've chatted to a few people who have said, who have similar, made similar decisions where they hired a practice manager or an administrator, and it's often a very expensive employee, but
Yeah,
it is the most valuable employee that you add to that business, because it just allows things to work. Yeah,
exactly. We need to start thinking that we are veterinarians. Like, do you know when you see an owner of a dog saying, okay, I saw this in the internet and I'm trying to do with the leg, and they say, oh, you're doing all wrong, you're messing up. I think it's how this manager and the administrator look to us and say, oh, this girl is messing up the business.
that's
But it's
brilliant.
true.
No, that's absolutely true. It's absolutely true. We spend far too much time and energy doing the wrong things because we just don't know better. We just don't know better. No, you're right. Um,
Yes, and people kept that message. Oh, I will do. I won't pay someone to do for me. But like, you are saving money when you do that. When you pay someone to do this kind of stuff, you are saving money. It's incredible how you save money. I say, oh yes, I was paying everything on taxes, and he changed it everything. So, oh my God, look to this money. It's true. It's very valuable. It's the best employee we have.
there is a quote that says something along the lines of, and now I'm going to get it wrong, but it's something like, smart people or successful business owners or something like that spend money to save time, and not successful businesses spend time to save money. We need to save our time, not our money.
It's
So Maira,
perfect. I won't add a bullet. I won't add a point. It's perfect.
Yeah.
And,
I must
and
remember where I saw that.
yes, and we have this feeling that like the business is mine. I need to rule it. No, we need to do like clinics, veterinary. We need to do what we know how to do it, and what we like to do. Like we have. I have another phrase that I like. You have to have a business, not to be a business. Yes,
Yes.
like the business just do not need to be just you. Do you know, like in April I'm going to France and to spend like 3 months in the University of Lyon to do research in the University of Lyon. It's a partnership between University of Lyon and the University of São Paulo. And people used to know, wow, how can you do it? Live 3 months your rehabilitation center and say, okay, yes, because I have a business. I am not a business. I have a business. So I have a support team that will take care of all the patients. Of course, a lot of WhatsApp and calling during this time, but you can manage things so you can have a life and you also can have a business and do your clinical practice.
I think that's such an important thing to think about when we are deciding with what we want to do. Do we want to work for someone? Do we want to start a business? What do we want to do? And Sasha Foster did a fantastic training for us on the business basics section in our members portal, where she speaks about creating a business and a work life that supports your personal life. Because many of us, we will struggle with burnout at some point, or with compassion fatigue, or with some form of just neglecting our personal lives, neglecting the things that we need to stay healthy and sane. And I think creating a business that allows you to do the things that you love to do is really important. We need to be able to have that flexibility and freedom if that is what we need as an individual. We are all different, so there's no one recipe that works for everyone. Yeah.
Yes, it's true. But even like people who only like they work by themselves, they do not have a full business, a rehab center. That's a way to manage to have someone working with you, not just for you, but working with you to manage this. Because I see mainly with physical therapy, we need to think that it's a lot of physical work. Yeah. And imagine ourselves with 70, 80 years. You won't be able to stretch a German Shepherd on the ground. We need to be realistic. Yeah. So we need to build. I don't know. I find this way opening a business, but there's a lot of ways to manage your life so you can, when you are 70, 80, to have a support. Yes. So you will just like do, I don't know what you like, but just working for the daily money is not the way. You need to think in the future a little bit more. I see a lot of people working with physical therapy, like thinking, okay, I want 70 with this one, 80 with this one, like literally counting the money of the day. But you need to think in a long time. Yes, because literally it's different from like someone that works in a computer. With 70, they can work in a computer. Like you can stretch a horse. Yes, when you're 70 years old, you won't be able to do that. Not really, not well. Exactly, not well. Yes, we have just in small animals, we have just German shepherds or Labradors or another big dogs that can't walk, and we need to carry and stretch, and it's impossible to do when you're older. So we need to plan our careers in a way that when we are at this old, we can have some money, we can save money, there are a lot of ways to do it. But people who work with physical therapy sometimes stay too much focused on the daily win. Like, oh, today I want this. Oh, okay, we'll spend all the money, or I will buy a car. But let's think when we get older.
Very good advice, Maira. Very good advice. Is there, what else would you say to people coming into the industry? What advice would you give them as they're starting out in our profession?
Yes, first I really, really recommend them a minimal administration course for exactly this. Like, okay, you need to administrate, to manage your money for the lifelong if you're going to get to animal physical therapy. You need a way to administrate, to manage, to save money for when you will be older. I really recommend them. And also I recommend a lot them to study neurology, orthopedic diseases, and pain control. I always tell them to study hard, but not just the technical things. I study hard also how you're going to live your life. Like veterinarians used to just work, like they are hard workers. Veterinarians around the world, I see they are really hard workers, but they do not see the long time. They really, like when they are 50 or 60, they start to say, okay, what I'm going to do, because physically I can't deal with this anymore. So I always talk to them like this: think in the long time, and because you will need it.
That's very good. And for those of us who want to get involved in research, do you have any advice for us?
Yes, I love the research. I love my work in the university. I love to work with the students. Like, I always think that it doesn't matter if in the clinics or it doesn't matter if in the university, you are always dealing with people. Yes, people who want to deal with research, I think they need to deal with people, and they need to, of course, as there is a technical practice to learn, you need to learn how to do research, because people think it's just, oh yes, let's just do something with the dog and evaluate it, and it's it's very difficult. You need to be very patient, and there is a lot of difference between the practice and the research. It's like, it's very do you know, I have experienced this when I started my master. When I started my master, I have planned a huge project, because I thought, okay, in my clinical practice, I have dogs that come twice a week easily. Yes, people come here twice a week. So I will do a project with twice a week, 4 weeks. It's okay. But when you go to research, this changes a lot. Like, if the dog do not come one time, you will lost the dog. You will lose the dog. So it changed too much. And I think when people want to start working with research, they first of all they need to look for an advisor, yes, a professor to teach them and to start. And so they need to look for the university to do research. It's do you know, the research requires ethics statements and approval for ethics committee, for you to really say, okay, I'm not hurting the dog. The dog will be okay. The dog. There's a lot of steps, and you can't just do research like, okay, I will do research with the dog in my clinic. You can't do this. You will really need the foundation of a university to help you. So if you want to start with research, I recommend to search for a professor in the university where you live, and to propose, okay, I would like to work with research in physical therapy. How do I do? And do you know, mainly people say, oh, but there's not a professor here in the university that works with physical therapy. But probably there's someone that works with orthopedics, or with analgesia and pain control, or another fields related to physical therapy, where you can put your project and help them That's what I did in the University of São Paulo. I started in the ambulatory of pain control and palliative care related to Professor Denise Fantoni. It's where I started working with physical therapy because it's all with pain, all related to pain. And then we started a big, and now we have a team of research and rehabilitation. So I think this is the way, like go to the university, find a way, because it's too different from practice. It's another knowledge, but it's a beautiful knowledge. And we took 3 or, and it needs patience, we take like 3-4 years sometimes collecting and analyzing data to have just one paper.
Yeah.
Yes, it's totally different from like, okay, we rehab a dog and the dog is good and that's okay. No, it's very different.
Maira, thank you so much for your advice. That was really brilliant. I think you've given us all some great things to think about, and I really appreciate your time. So thank you so much for joining us, and I'm sure that we will see you online with us again.
Oh, hopefully, please feel time if you want to talk another things, more technical things, please contact me. And I don't know if you can share with people that are hearing my email.
We'll add it into the description so you guys can
Oh
copy and
yeah,
paste
it's there.
the
Maira
description.
Formenton. I don't know how to say the
At,
thing at
at
gmail.com.
oh, perfect, nice and easy. Maira, thank you so much. Have a wonderful day.
You too. Thank you a lot. Hope to see you soon.
If you enjoyed listening to this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about veterinary rehabilitation. For more information about continuing education for vet rehab therapists that you can do online, you can go to onlinepethealth.com. I'd like to thank you for listening to this podcast and, of course, thank our sponsors, Pulse Vet. We thank them for their commitment to their mission to improve the quality of life of the animals that we all love by developing, validating, and providing advanced shockwave therapy at the highest level of support and service. Remember, you can reach them at pulsevet.com or info@pulsevet.com. See you all next week.